Hello, everyone. I'm Miley, and today we're discussing the vital topic of cervical cancer, focusing on how this disease disrupts normal physiology and the powerful tools we have to detect and eliminate it. Cervical cancer is a serious disease, but it also is one of the most preventable and curable cancers, provided if it's caught early. To truly understand the disease, we must first understand the healthy system it attacks. Let's quickly review the normal female reproductive anatomy. The key structures include the ovaries, which produce eggs, and key hormones such as the fallopian tubes, where fertilization occurs, and the muscular uterus, where pregnancy develops, the cervix, which is the gateway to the uterus, and the vagina. The entire system is governed by a delicate hormonal balance, which is involving the hypothalamus pituitary ovarian axis, where, for example, FSH and LH from the pituitary glands drive egg maturation and release. Estrogen builds up the uterine lining, and proestrogen primarily is from the corpus luteum, which maintains the lining, which is readying the body for pregnancy. All these hormones coordinate the functions of the system, such as egg production, hormone regulation, and pregnancy support. Crucially, the cervix produces a mucus barrier, which changes consistently to either block or facilitate sperm entry, and the key aspect of natural immunity and fertility. This is a diagram of female reproductive organs. And if you see here, you can see the ovaries, where they're located, the vagina, where our cervix is located, where uterus, where during pregnancy happens, and our fallopian tubes. Now we move on to cervical cancer. Cervical cancer is defined as the uncontrollable abnormal growth of cells starting in the cervix, and is globally it's a major health concern which affects most women aged 30 to 50 and is leading to over 600,000 new cases worldwide each year. The reason early screening is so important is that initial symptoms can be subtle or non-existent for some people. And when they do appear, they often include abnormal bleeding, especially bleeding after sex or between periods, or even after menopause. And it also includes pelvic pain and unusual discharge. The single most critical piece of information is its cause. Nearly all cases, 99.7% of the time, are caused by persistent infections with high risk types of HPV. This sets the stage for physiological changes where we'll be discussing next. How cervical cancer can alter normal physiology. So this is where the molecular pathology occurs. Once high risk HPV infections become persistent, the viral DNA integrates itself into the cervical cell's DNA, and the virus then produces two powerful viral oncoproteins, which is E6 and E7. These proteins are known for being master hijackers of the cell's security system. So, first up, the E6 protein targets and destroys the tumor suppressor P53, where normally P53 monitors the cell's DNA and triggers cell's death. If DNA is too damaged, by disabling P53, the virus allows cells within DNA damage to survive. Our next one is the E7 protein, which binds to and inactivates the tumor suppressor RB, which is retinoblastoma protein, where RB acts as a cell cycle brake. And by releasing this brake, E7 causes uncontrollable proliferation, where the cell starts dividing endlessly. The combined effect of these proteins is a cell with damaged DNA that grows uncontrollably. At the tissue level, this leads to dysplasia, which is abnormal growth, which progresses from precancerous lesions, which is CIN, to invasive tumor formation. The resulting tumor disrupts normal cervical structure and, in advanced stages, can invade surrounding structures like the uterus, which is leading to kidney failure or spread to distant organs. And then we're going to talk about diagnosis from screening to confirmation. Because early cervical cancer is often silent, screening is paramount. So, diagnosis start with screening tests. The pap smear detects abnormal cells. The HPV test detects the high risk HPV DNA itself, and these are often used together in co testing. If screening is abnormal, we move to follow up procedures like colon- colposcopy, which uses magnification and light to visually inspect the cervix. A biopsy is definitive step, removing tissue, something via like conobiopsy or LEEP, from a pathologist to confirm the presence, type, and severity of cancer. Finally, imaging scans like CT, MRI, and PET scans are used to check for spread to the lymph nodes or distant organs, which is critical for staging and treatment planning. Then we move to treatment options for cervical cancer. Treatment is tailored based on the stage. If early stage 1, treatment is primarily surgical, and this can range from a cone biopsy, LEEP, to remove small lesions, often preserving fertility, to a full hysterectomy, hysterectomy. For women who want children, a radical trachelectomy is an option. Locally advised stage 2 to, I think it's 6-5. The gold standard is concurrent, where chemoradiation therapy, which is CCRT, or chemotherapy acts as a radiosensitizer and making the cancer move vulnerable to both external beam radiation and highly targeted brachytherapy, which is internal radiation. If we get to the metastatic stage, treatment is systemic, which is focusing on managing the disease using chemotherapy and increasingly immunotherapy. But we cannot overstate the importance of prevention. The HPV vaccinations and routine screenings are the most effective treatments available out there. Then we move on to our prognosis and recent innovations. So, the prognosis highlights the value of early detection, where the 5 year survival rate is over 90% for localized stage 1 disease, but drops significantly for advanced stages. Recent innovations offer hope on both of the preventive treatments fronts. So, advanced treatment, immunotherapy, like a checkpoint inhibitors, has emerged, offering improved outcomes for advanced and reoccurring diseases by harnessing the patient's own immune system. Diagnostic axes such as HPV self sampling is making screening easier and more accessible for women globally, helping to meet the WHO's goal of screening, where 70% of women worldwide global goal. The WHO has set the ambitious of 90-70-90 targets by 2023 to essentially eliminate cervical cancer as a public health problem through vaccinations, screening, and treatments. These are the references that I have used, where Celadine K, Anatomy and Physiology, The Unity of Form and Function, 10th edition, World Health Organization, Cervical Cancer, 2023, National Cancer Institute, 2023, Cervical Cancer Treatments, Aubrey M., which is 2020, Cervical Cancer Prevention, Evidence, Challenges, and Future Directions, Crosby Cervical Cancer, American Cancer Society, and Frege M., Immune Therapy and Cervical Cancer, Recent Advances, Frontiers in Oncology. that is it for today. And cervical cancer is a largely preventable disease. And by prioritizing your HPV vaccination and routine screenings, we empower patients and healthcare systems to intercept this disease. Thank you.